In tonight's Med Team report, they have been called the silent cancers in men. Prostate, colon, and testicular cancer can advance sometimes slowly without noticeable symptoms. Early screening is the key. During this Men's Health Month, our Michael Richardson spoke with Med Team Dr. Ed Dominguez about what men need to know.
Prostate cancer frequently can be a very sneaky type of cancer.
Med Team infectious disease specialist Dr. Ed Dominguez says some of the symptoms of prostate cancer include heaviness around the pelvis and difficulty urinating. The American Cancer Society estimates there will be over 330,000 new cases of prostate cancer this year. Screening is recommended between ages 40 to 50, depending on family history.
Bleeding in the urine should always prompt both male and female, but in the case of prostate cancer, prompt a male to be seen relatively soon, if not immediately.
A simple blood test can determine risk. The American Cancer Society says colon cancer is the third leading cause of cancer-related deaths in men. Depending on family history, folks can be screened younger than age 45, and in certain cases, that may not require a colonoscopy.
Like there's a little pill camera that you can swallow. There's other types of imaging studies that involve drinking contrast.
Testicular cancer is not as common as colon or prostate. The American Cancer Society estimates there will be fewer than 10,000 cases this year. Self-examination, Dr. Ed says, is key to fixing a problem before it gets worse.
And if you notice any lumps, bumps, pain for sure, enlargement that is unexplained, that should be evaluated immediately.
Michael Richardson, East Texas News.
Now, the American Cancer Society says localized prostate, colon, and testicular cancer have a 5-year survival rate in the 90th percentile. For some of those, it's even higher.